So at the 7 locations that we have of pharmacies here at Omni Family Health, we primarily offer retail services. Along those locations, we have free delivery from a courier service, and that's primarily for patients that are having transportation issues, like they don't have a vehicle or they don't live nearby within a 30-mile radius of a pharmacy. We also offer some clinical services like clinical medication management that are provided by the clinical pharmacists at the facilities. Some of the clinical services that we're able to provide here at our facilities are, because of a collaborative agreement, actually allows us to work with the providers here at Omni, whether it be an MD, DO, nurse practitioner, podiatrist, dentistry, and allows us to actually do things that you wouldn't normally do at a retail setting. Some of these things are to actually look into the patient's profile and either discontinue medications, add medications, and better serve the patients themselves. All of these is actually done by the funding of the 340B program. It enables us to actually compensate the clinical pharmacists to do these services for the patient. So we have a courier service that allows us to deliver to over 600 patients each day. In that time frame, they're able to hit Fresno, Kings, Tulare, and Kern counties. What actually allows us and separates us from other pharmacies, it actually allows us to go as far as Ridgecrest, Tehachapi, Lost Hills. Some of these areas, they don't have a pharmacy, and so they actually rely on our pharmacy to deliver to their home. Here at Omni too, we do realize that there's also other barriers to adherence, which is basically patients getting their medication. They can be the transportation, which we try and solve with the actual courier service. They can be a language barrier, things that people want to take their medication but understand it in their own language. We have 2 clinical pharmacists that actually speak Spanish and are able to translate the medication and give counseling to these patients. But we also know that there's other languages as well. So we have pharmacists that speak Arabic, we have Tagalog, we have Vietnamese, we have all these languages to better serve our community. So here at Omni, we're a mission-driven organization, and we will provide healthcare regardless of the patient's ability to pay. And sometimes that involves the uninsured. And we have a sliding scale that allows us to actually serve these patients based on whatever income they're bringing in. And they can qualify for this by just bringing in pay stubs and such to our offices, and we can meet them at the level of income that they have. We are actually a FQHC, which is a Federal Qualified Health Center. And that's just a program that allows us to basically stretch any federal dollar that we get with a 340B program, put it back into the community. So we're a nonprofit. So most of our profits that we come in from the 340B income, we pour back into our organization to serve areas that other clinics don't want to serve, like Ridgecrest or Tehachapi. Some clinics, they don't want to take the Medi-Cal or Medicare, and we do, because we know that there's a need for them, and this is how we are able to serve these communities. So if we would lose the 340B program here at Omni, it actually causes more strain on the actual community. Instead of having these patients go into our clinics, they would have to find another ways of getting healthcare. What we've seen in the past is they will go into the hospitals and it'll put more strain on their resources. And instead of them, primarily focusing on life-threatening issues, they're going to have to start serving patients for stuff that we do at the clinic. And actually, some of the other services, like the clinical services that we have here at Omni, would also have to be scaled back to if we lose this program.